Hello, my name is Zoie Aikin. I've been asked by Matthew Clark to give a talk as part of the Royal College of Pathologists What I Wish I'd Known series. Matthew Clark is the chair of the Trainees Advisory Committee, and he wanted me to give some tips for trainees who are sitting the exam in the spring. I sat the exam in the autumn and passed. I am a clinical scientist at HSST in microbiology in my final year now. I'm employed by Public Health England based at the Manchester Foundation Trust, and I've put FRCPath in brackets as I've not yet paid for the privilege to use the post-nominal, but I'm in the process of doing so. This talk's about 20 minutes long, and I hope that you find it useful and you can pick up some useful information that would help vision. So my top 5 tips are here, and I'm going to go through each of the tips in a bit more detail just to give you a little bit more information on what I found useful when I was revising. So the first is study group. So I was in 2 study groups in the preparation for my exam. So I was thinking about doing my exam in my 3rd year, and ended up during my training having 2 lots of 1 year's maternity leave, and so we were preparing for this exam for quite a long time. In both study groups that I had, so I was in a study group a couple of years ago, as I said, and then I was in a second study group for about 4 months, 3 to 4 months in the lead up to the exam, so over the summer. The study group consisted of a mix of registrars and scientists, and I think we all agreed that worked really well, having that mix of backgrounds. The study group there were 4 of us in the study group. Towards the end, a 5th person joined, and I think that was a nice number of people as well. I think any more, and you wouldn't have had I don't think every member of the group would have an opportunity to speak. And I think having at least 3 people meant that you were able to divide work between you, and there wasn't too much onerous on any one person within the group. The main thing that we did in our study group sessions was to work through mock questions. So I knew a few people who'd done the exam before and contacted them, and they sent me these mock questions. And in their study groups, they had each taken it in turns to write 20 questions. And they were quite short questions, and they gave them out to the rest of their study group, and then they discussed the answers together. So it might be something quite as straightforward as a picture of an organism, strep pneumo grown in an agar plate, and there might be 3 questions asking about what is this organism, how would you identify it in the laboratory, what countries are associated, so what resistance is associated with, something about foreign travel and strep pneumo, and the resistance that you would be concerned about, and something about something about infection control, or something about infection control. And they were all quite short. And so within an hour and a half study group, we would be able to get through maybe a whole lot of questions, maybe 10, maybe all 20 questions. And that it just worked really well that we were, and it just stopped us getting into too much detail about any one subject area, because we were always ready to move on to the next question. Things that you could do within the study group that we didn't do as much would be things like devise essay questions, divide them up amongst your group, have journal club discussions, and the main thing is that you can share resources. So we had a WhatsApp group as well, and so if we found a paper or if something interesting happened at work, we could easily share it amongst ourselves. And we were the ones who were most interesting. You're revising for your exam, you're revising every night. Your colleagues are not at the moment. And also, we were split between either ID or micro, and so there were different practices that we were able to learn from. Yes, that we were able to learn from. The second is the acronym CLIP. So in my first study group, we agreed on the list of headings on the right. And for each subject, each organism, each infection, each parasite, we were going through each of those headings. And then I heard about CLIP. And actually, I think this is a much more useful acronym, because quite a lot of the areas that you need to cover in the exam are much more than just the clinical and laboratory. You need to have an awareness of the infection control and public health implications of the infections. And I think to give those two headings equal weighting to the clinical and laboratory is quite useful in the way that you approach your questions. So going through each of the sections of CLIP, I've listed the main resources that I use for each of these areas. So I bought Mandel at the beginning of my training, and Mandel is a great resource, but the trouble is, for most organisms in Mandel, it can be associated with most infections. So I didn't find it that helpful, particularly in the weeks leading up to the exam, and actually found things like the Oxford Handbook, Up to Date, and Sanford much more useful. Just thinking about what are the most common presentations with these with this organism, what are the most common tests that are used to identify this organism. Go back to your Part 1 revision resources. They are really useful. So there was somebody in our department who was sitting there Part 1, and we did lots of joint revision together. And I also looked back on my Part 1 revision. NICE have got some good guidance on things like TB, and the BIA Learn Infection website has got some great short answer questions as well. L is for laboratory, the main laboratory resource that I used were the PHE SMIs. The flow diagrams at the back of the SMIs stands for Standards for Microbiology Investigations, are particularly useful. And for serology, things like hepatitis B and syphilis serology, they've got really nice tables that give you that help you interpret the results. The Public Health England Reference Lab user manuals, the RIPPLE and the Bacterionology Reference Unit are very useful for tests that you don't perform in-house that are sent away, things like Lyme disease and leptospirosis. You'll have guidance in your local SOPs, and then kit insert YouTube websites for practical tests that are not commonly performed. So things like the tube coagulase test, urease test, indole test, these kinds of tests that we just don't do anymore in the lab because we've got the MALDI, but you would be expected to know about for the exam, particularly because if your MALDI failed, what are you going to do? How are you going to identify anything? These tests are going to stick in your head much better if you've at least seen them. If you can see them in your laboratory, that's great. But if you can't see them in your laboratory, but you have watched a YouTube video or looked on one of these websites and had a chat about it in your study group, it's much more likely that you'll be able to recall it in the exam. For mycology, there's the blue book, used to be the purple book for identification of pathogenic fungi. And Dr. Fungus is a really good online resource as well. And I think for mycology and parasitology, it's about getting used to seeing the images and seeing the images again and again and just getting familiar with them, so that when you see an image of an egg or mucor in the exam, it's not going to completely freak you out and you'll be familiar with it. And if there are any images that you see in any of the spots or in any of the resources that you use that you're not quite sure about, just ask one of the BMSs in your lab. There will be a BMS in your lab who is the go-to person for parasitology, the go-to person for mycology, and they will love having the opportunity to talk about their pet subject area. Infection control is next. The Scottish National Infection Prevention and Control Manual. It's quite a mouthful. If you Google that is a resource that was recommended to me by our infection control consultant. I've not felt like she and I have not found a better English resource. and it goes through like from very straightforward standard infection control precautions through to more complicated, things about outbreaks and such. Lots of information about COVID on there as well. An excellent resource to look through. The HTM documents are long, dry, detailed documents which give guidance on water, decontamination and ventilation. These are topics which, if you are an infection control doctor, you would need to you would need to know where to find this guidance. And in the exam, you would also need to be able to recall information from some of the tables that are in those documents. In order to try to get that to stick in your head, I'd recommend going to some of your local, even just one of your local water management group meetings, local decontamination group meetings or outbreaks, and then just collar somebody at the end of the meeting, or just arrange a post-meet chat with somebody at the meeting who will just be able to help you if you've got any questions about those documents. I spent some time I just asked the head of the endoscopy unit if I could come and have a look at the machines, the instruments, and he just talked me through some reports that they got back from their lab. And it just made so much more sense to me seeing the endoscope, the washers, the dryers, looking through the reports. I had some questions that didn't quite make sense to me that I sent to him, and he answered them. There's questions about CJD, and it's what he does all day, every day. So he was much more comfortable talking about those rather than me trying to answer them from just what I read with no actual hands-on experience. And then the Healthcare Infection Society have training days, I think 3 training days every year, and they run the foundation course in IPC. Somebody in our study group had been on the foundation course and shared his notes with us, and the notes on ventilation were really useful and made a lot of sense. And then the last is public health. So the main resource for public health is the Green Book, Immunisation Against Infectious Disease. There are a number of PHE guidance documents as well, I think mainly to help the people working in the health protection units. So there are guidance documents on the public health management of diphtheria, hepatitis A, Legionella. And there are health and safety executive documents such as L8. And if you are able to spend some time with your local health protection team, or if they have delivered any local teaching, it would be worth getting hold of those notes or spending some time with the HPT if they allow. Because of COVID, I couldn't spend any time with my local HPT, but I did ask the consultant for some guidance on what they deal with, what infections they deal with most commonly pre-COVID, and I asked for a top 10, and she sent me this list of 14 different infections. So it just meant that while I was making revision notes for these areas, I was making sure that I was paying particular attention to public health and making sure that I was considering the public health implications of these infections and not getting too drawn into or focusing too much on the other clinical laboratory infection control aspects. And then just being aware of what organisms and infections are notifiable. My third tip is practice. So the sessions, I went to a session similar to this time last year, maybe, yeah, and there was a lot of a focus on making sure that you could write for 3 hours and that your hand could handle that much writing. Whereas, of course, that doesn't apply now because it's an online exam. So you just need to make sure that you can type for 3 hours and then another 3 hours in the afternoon. And I think there's a lot of exam technique as well. So there was a word count set for certain questions. So you only had 20 words to answer your question. So keep an eye on what the word count is for each of the questions. Make sure you stick to the word count and practice being concise. The Leicester mock exam I think it's this week. I think it was £200, and it was such a good, such good value for money. It was a very long day. I didn't do very well in the exam at all. I certainly didn't pass it, didn't come anywhere near to passing it. But the practice and the practice, it was just such good practice. The face-to-face sessions were very similar to the face-to-face sessions in the mock, and in fact, yes, when I went to the mock exam, it was face-to-face. I understand it's online now. It was just such good experience being able to sat doing the online questions and then being taken out to do the face-to-face OSCE, and then going back and finishing the rest of the stations just at my desk, getting practice at jumping from one topic to another, being able to get into the habit of timing myself for doing each question. And it was the organisers were great and went through all of the answers. There was ample opportunity for discussing our answers, if our answers weren't quite the same as what they put down. So if you do have the opportunity to go to the mock or to speak to anyone who's been to the mock, if you weren't able to get onto it, then I would recommend that. Practice critical appraisal. So if you're a member of a journal club locally, then that would be great. There are journal clubs online. There's infectious diseases one that I'm aware of, this IDJ club, which is based in America. So I've never watched it. I've never participated live because it's in the middle of the night. But I do look at it. It's once a month. I do look at it and scroll through after the sessions have taken place. The CAS criteria are really useful criteria, and the things that the points that you need to address as part of those criteria are the kind of questions that you would be asked in the exam. So it's good to familiarise yourself with that. Good to get into the habit of going through those criteria and thinking about those when you're looking at a paper. You need to know some quite, basic concepts like different kinds of studies, common statistical methods that are used, be able to define incidence and prevalence, be able to calculate an odds ratio, number needed to treat, be aware of bias, be able to do a 2x2 table to calculate your sensitivity and specificity, and so on. And then practicing essay questions. So I sat down, I did do a couple of essay questions that I sent to my consultants, and they marked, and that was useful. I sent one to a colleague of mine who'd recently sat the exam, and she marked an essay question for me. I sat down with one of my consultants and we brainstormed 4 different essay plans. So we between the two of us thought about 4 questions that would be likely to come up, and just thought about all the different areas that should be covered in answering those exam questions. And I think it's useful to practice writing under timed conditions as well. So once you've got your essay plan, be able to sit down, write the outline, fill in the gaps, make it a concise, clear essay in 25 minutes. My 4th tip is little and often. So I think, especially coming up to, we're so close to the exam now, I think even if you can't be bothered, and I think this is also a good thing about the study group, even if you can't be bothered, knowing that you've got the study group means you are going to revise for an hour that night, you are going to go through things. Even if you can't be bothered, it is still worth sitting down, going through a few spots questions, going through a case history in a case histories book, and going through some questions on learn infection. Just keep on going. You're nearly there now, and I just think it's just useful to just keep on, dipping in and getting used to jumping from topic to topic. A bit like when you're on duty and you're answering the phone and you never know what call's going to come next. And then my last tip is to speak to others. Speak to others who've done the exam, speak to others who are preparing for the exam, speak to your consultants, speak to your colleagues, share resources. your consultants are very busy. It's a very challenging time at the moment. But if you can get them to just spare half an hour with you, you go to them with questions that you've got based on their specialist areas, and I'm sure they would be more than willing to help you. If you're watching this presentation and you're not sitting the exam in the spring, you are thinking about sitting it at a later time, or you are sitting it in the spring and you know somebody who's been to one of these courses. These are courses I've been to, these 3 courses I've been to during my training, and they were really good at providing that, you know, basic, or much more than basic knowledge in those 3 subject areas. And then if you can arrange placements at your local HPT or infection control team, I think that would be very worthwhile. Although, again, if you are sitting the exam in the spring, it's probably a bit too late for doing that right now. And then my last tip is about exam technique. So you're allowed a whiteboard in the exam, and I wasn't quite sure how I'd use the whiteboard in the exam. But what I used it for was to work out how much time I'd spend on each question in the paper. So, for example, in the OSCE exams, you've got 15 questions and you've got 3 hours to work on it. I just took the 3 hours, thought, oh, well, I have to give myself 20 minutes at the end to go through all of the questions, and then divided the rest of the time into slots. And then wrote down how much time I'd give myself for each question. And I was really strict about moving on to the next question when I was out of time, even though if I hadn't finished answering the question and I had a couple of marks I hadn't yet addressed on that question, moved on to the next question, wrote down the time that I was starting the next question. The test reach software is really good in that it's very easy to highlight and very easy to see questions that you've highlighted that you've not finished and you're unsure about. And then you've given yourself time at the end. You've got 20 minutes, which is loads of time to go back through your answers, make sure you've answered things properly, make sure you've kept within the word count for each of the questions, and you've got time to look at questions that you just didn't know the answer to. And when if there are questions at the beginning that you didn't quite know the answer to, when you're moving on to the next question, you're going to be thinking about it in the back of your head, and you might have some brain waves, the answer might come to you. So I think exam technique and being very strict about that, and the same with the essay as well. Don't spend any more time on the essay than if it's a third of the marks, give yourself a third of the time. Be very strict about that. So that's a summary of my top 5 tips. I hope you found this presentation useful, and that, yes, there will be something from this presentation that you'll be able to take and apply to your revision, and it will be useful for you. I wish you the best of luck in the exam. Thank you for listening.